Can you see that okay?
Yes, perfect.
Okay.
Thank you. We hear
Thank
you just
you.
fine. Great.
Perfect, thank you. So my name is Amy Rama. I'm faculty at Wesleyan College in Rochester, New York. And I developed and teach an older adult, healthy older adult concepts class. And last year I worked with a student on a project related to that class. So just with some background, the older adult population is increasing along with the need for healthcare professionals who care for them. Many older adults will live with some form of disability. According to the Family Caregiver Alliance, the lifetime probability of becoming disabled and at least 2 activities of daily living or being cognitively impaired is 68% for people 65 and older. Nurses are an essential part of the healthcare team that cares for these older adults. Nursing students are the next generation of nurses who will care for this growing population. Regardless of the specialty, most nurses will interact with older adults in some capacity. It's therefore critical to assess how nursing students feel about older adults and prepare them to care effectively for this population. The purpose of this project was to describe nursing students' attitudes towards older adults and describe how views may change with the addition of an older adult health concepts course. The course focuses on normal physiological changes with age and common diseases and disorders that affect older adults. So with the literature review, this revealed a common theme that nursing students generally are not interested in working with older adults after graduation. One study noted that societal views are focused on the younger population and aging is a negative process. One study explored elements of raising enthusiasm for older adults, and a major finding was the impact of key figures in schools on the students' attitudes. If the faculty have positive attitudes about geriatrics, students were more likely to share the same views. This study also mentioned the importance of the content to be intellectually challenging and appealing to students to promote an interest in the subject. Another study noted that there is lack of good gerontological education and that many nursing students felt unprepared on the subject. Therefore, the purpose of this project is to understand attitudes towards older adults in the beginning baccalaureate nursing students in a small liberal arts college. The project had 2 main focuses: baccalaureate nursing students' attitudes towards older adults and how or if those attitudes changed. The first part of the research was a questionnaire that focused on asking the students their initial thoughts and feelings about the older adult population and if they would be willing to care for this population in their future careers. The second portion of the project was an additional questionnaire that reassessed the thoughts and views towards older adults and working with this population, but also if they felt their education impacted their attitudes. The purpose of this was to understand how the attitudes might have changed with these interventions and what interventions might be helpful in the future to promote positive views of older adults. The design was a qualitative project involving baccalaureate nursing students at the junior level at a small liberal arts college in Western New York. The qualitative data were obtained through open-ended questionnaires that encouraged the students to express their thoughts. The setting of the study takes place in the classroom at Wesleyan College. Data were collected in questionnaires that junior level nursing students completed at the beginning of their required Healthy Older Adults Concepts class in the fall of 2020 and at the completion of that semester. The students were given paper copies of the first questionnaire during one of their classes by the professor. The second questionnaire was emailed at the end of the fall semester for the students to answer online via secure survey format. There were 17 participants for the first questionnaire and 13 participants for the second questionnaire. In the first group, 7 participants stated that they had professional experience working with older adults. 6 said they had personal experience, and 4 said that they had no experience working with older adults. The participants were selected from the traditional undergraduate program. In this program, 90% were females, 10% of students were males. The students in this group were primarily 19 to 24 years of age. Approximately 25% of the students were diverse in ethnicity and background, and 10% had another degree. The first questionnaire asked about the words that immediately come to mind when thinking about older adults in order to determine the students' initial reaction to this population. It also asked about any experience working with older adults and how students feel about having to care for the older adult population. Lastly, asked if they would ever consider working in long-term care with older adults. It also inquired about any changes in feelings, attitudes, or opinions about caring for older adults after the course. It asked what methods of education or resources help them work with older adults and what additional knowledge they felt they needed. The last part of the survey was an option to leave any comments they had. The data were interpreted with qualitative analysis by identifying major recurring themes noted in the students' responses with a team approach. The student And the faculty advisors analyzed the data separately to understand the data and identify themes. Next, the advisors and the student met and discussed the individual findings and agreed on certain themes. The faculty and students sifted through all of the data to determine its significance to the study and returned to the data to confirm the interpretation. Both questionnaires were evaluated in this manner to find the recurring themes that reflected students' attitudes and any other significant data that related to the research aims. The three major theme groups that were identified from this first survey are barriers to caring for older adults, positive thoughts about care, and word descriptions of older adults. The first group of themes is the barriers to caring for older adults that the students mentioned in the first survey. This group of themes came from the question that asked, would you ever consider working in long-term care for older adults? Why or why not? And from the question that asked, when you think of having to care for older adults, how do you feel? There were a variety of responses, with some students mentioning that it was boring, they would rather work with kids, they didn't want to care for the end of life, or they were scared or intimidated. An example of this fear of working with older adults, a student wrote, working in geriatrics scares me. I worry that a patient will follow my watch and will severely injure themselves, such as breaking a hip. This student and others reveal their fear of caring for older adults as a barrier to care. This illustrates some of the barriers to care as themes in the first survey. The next set of themes from the first survey are about positive thoughts about caring for older adults. This group of themes also came from the same questions mentioned. The themes that were identified are honor, rewarding work, excitement in learning new things, positive connections with patients, and enjoying seeing the population cared for. One student said that they would feel honored. Personally, I think that older adults have a lot of wisdom and stories to share. I love to work with the elderly population and just to spend time with them. These themes are all a part of the positive aspects of care that were identified from the first survey. The next set of themes are one-word descriptions that students were asked what words immediately come to mind when thinking about older adults. The words were categorized into three major themes: physical characteristics, knowledge and wisdom characteristics, and other miscellaneous attributes. Some of the words that participants used to describe older adults in the physical theme are old, weak, slow, declining, wrinkly, fragile, and sick. Some of the words that were used in the knowledge and wisdom theme were wise, knowledgeable, storyteller, senile, and opinionated. The last category is miscellaneous attributes, or words that the students used, and some of these words are grumpy, needy, fun, caring, gentle, quiet, stubborn, respected, and old-fashioned. The positive and negative aspects can be seen in these themes, like storyteller compared to senile. This is the last set of themes from the first survey. The groups of themes that were identified from the second survey are psychosocial and physiological themes and identified learning needs. A major psychosocial theme that arose was students recognizing older adults' needs for respect and dignity. One student wrote, the Healthy Older Adults Concepts course served as a good reminder that our older adult population deserves all of our respect when caring for them, and reminded me of the importance of ensuring that older adults keep their sense of dignity while being cared for. These quotes come from the response to a question asked about any changed views or perspective about caring for older adults. There were mixed responses, with some participants changing their views from not wanting to work with older adults to wanting to care for them, some students going the opposite direction, and some with no change from their previous thoughts, whether positive or negative. One student reported this no change from a positive view when they wrote, I believe my thoughts and feelings have remained the same while taking care of older adults. I have noticed more of how scared and lonely they may be, especially during these times of a global pandemic. These are some of the psychosocial themes that were identified from the second survey. Some of the physiological themes that were identified are a new ability to recognize age-related changes, making connections between aging body systems and comorbidities, and feeling more prepared to educate older adults on their health. One participant wrote, learning about the aging body systems really helped me connect the dots from things I learned or saw when I became a CNA and starting caring for older adults to now. It helped me to have a better understanding on how one system affects another and ways to educate aging adults in my life to enhance their health as they age. This student illustrates how the class helped make the physiological connections and feeling more prepared to care for the older adult population. Another student mentioned the theme about age-related changes when they wrote, certain aspects like blood pressure and heart rate were surprising to me, as well as skin deterioration was interesting to me. This person focused on the physiological aspects of the course when asked about any changed views or opinions about older adults. Lastly, a participant wrote, knowing how certain infections or illnesses affect the older adult differently compared to younger generations and how they present has helped to inform my patients and work and at clinicals about why they may be experiencing some symptoms. which also emphasizes these physiological themes from the second survey. The final set of themes that were depicted from the second survey are certain learning needs that the participants identified. The major themes that were identified in this section are the need for more clinicals in long-term care facilities, practical skills from clinicals and labs, and how to respond to aggressive or disturbing behaviors. These themes are related to the participants' opinions of what they needed to continue to learn. These were all the selected themes from the 2 surveys that were identified in this project. The results of this project demonstrate that nursing students have mixed perceptions of older adults, but education and different experiences can potentially alter how those students view older adults. The mixed results on students who change their views and whether those views are positive or negative can be affected by factors other than education that they receive. This project shows the importance of thorough nursing education in geriatrics. The participants' replies in the second study stated that the geriatrics course helped them learn and understand this population better. There are many opportunities for future research on this topic, and with that, many opportunities to improve the care of this growing population. And that is all I have.
Thank you, Amy, very